Welcome to Washington Hospital Today, the program dedicated to sharing timely information about the community hospital that's been taking care of Washington Township Healthcare District residents since it opened in 1958. Washington Hospital Today is provided for the sole purpose of informing residents about healthcare topics and issues that have been covered during community forums, free health and wellness classes, or as part of educational sessions held during the district's open board meetings. This program is one more way that Washington Hospital helps empower you, the residents of the district, by providing information needed to make informed decisions about your health.
So, I have the pleasure of introducing to you tonight our speaker, Dr. Chakravorty. She's my doctor, and she's probably some of your doctors too, right? Dr. Chakravorty has been in this community for a very, very long time. In addition to her practice, she is an assistant clinical professor at UCSF. She does a lot of community lectures. She is active outdoors person. She's just a generally nice person. So you're going to enjoy your talk with her today. Her talks are very popular, both on the internet. She gets a lot of hits, and she gets a lot of people coming out because she's a smart woman. So Dr. Chakravorty, come on down.
Thank you, Vida. What an introduction. Okay. Good evening, everyone. Welcome. What I'm going to talk about today is diabetes. I'm a diabetes specialist. Endocrinology is part of diabetes. And today's lecture is going to be very basic. I'm not going to cover any medications or any complicated, physiology or anything like that. It's just something that you need to pay attention to or take notes so that you can manage your diabetes and take care of yourself on a day-to-day basis. So nothing complicated intentionally. I don't have any copies of the slides because those are just bullet points. You're better off taking your own notes. And if you, as Vida said, if you want the presentation to view it yourself, you can always borrow the DVD. So with that, let's get started. So we'll start with the basics first. What is diabetes? Diabetes is a disease, it's a chronic condition where there is high blood sugar that affects all your organs. When you eat food, it's broken down into nutrients, mainly sugar. The sugar enters the bloodstream, it travels to the cells to be used up as fuel. Just like you put gas in your car, you need fuel to run your body, your metabolism. So sugar is your fuel, in addition to fat and protein. What you should know is in order to utilize the sugar that enters your bloodstream, you have to have the key hormone, insulin. Think of insulin as a key. It unlocks the doorway so that the sugar can enter your cells, your fat cells, and the muscle cells so you can burn it up and use it as energy. So there are two different kinds of diabetes. One is type 1, where there is not enough insulin. This typically affects children. The pancreas is the main organ that produces insulin. It sits right behind your stomach, towards the back. And somehow in children, the pancreas can be destroyed. We call it an autoimmune disorder. The immune system destroys the pancreas. And these individuals need insulin in order to take care of their blood sugars. Type 2 is a completely different process. There is enough insulin to begin with, but either it's not enough or the individual has something called insulin resistance. Remember the key and the doorway, somehow that key doesn't work. So the insulin can't work at that level and the sugar doesn't enter. So what happens? It backs up in your bloodstream and gives you high blood sugar. So that's, to put it very simply in layman's terms, what type 1 and type 2 diabetes is all about. Type 2 diabetics can need insulin down the road if they have not been under poor control because the pancreas does burn out. And then you need insulin to keep your blood sugars down. At that point, oral medications don't work. But it doesn't mean that you have converted to a type 1. You're still a type 2 on insulin.
Diabetes is a disease in which the body does not produce or properly use insulin. Insulin is a hormone made by the pancreas that the body uses to convert the food that you eat into energy needed for daily life. Let's take a closer look at how insulin works. When you eat, your body breaks down food into sugar. Sugar is used as a source of energy by your body. Sugar travels through the bloodstream to reach all the cells in your body. Sensing that you have eaten, your pancreas releases insulin. Insulin takes the sugar from the blood into your body's cells to be used for energy. This energy supports all of your body's functions needed to stay alive.
Okay, so now you understand about insulin and how it regulates your blood sugars and what diabetes is all about. See, I even had a movie for you. Isn't that nice? Okay, so this is more of the same. Understanding diabetes, the type 1, when your pancreas doesn't make enough insulin. Type 2, when your pancreas may be making some insulin, but it's either not enough or the cells are not responding to the insulin. So you have insulin resistance. Why is it so important? As I said, diabetes is a chronic illness, and it can be a debilitating illness if you don't take care of yourself. It affects every organ, every cell in your body. And these are some of the effects that you can see when you have uncontrolled blood sugars. You can have stroke, a heart attack, because it damages the blood vessels. You can have eye damage. The blood vessels behind the retina can get damaged. You can have retinal hemorrhage and blindness. It can affect the blood vessels of the kidney. So that results in kidney damage, and diabetes is now the leading cause of dialysis in this country. It can affect the nerves, and typically, initially patients present with tingling and numbness of the feet and the hands, and then that can be progressive. And of course, it can also, in males, it can cause difficulty passing urine and erectile dysfunction because all the blood vessels are destroyed. So that's what happens with high blood sugars. So we have to learn how to adjust with diabetes. It's not very hard to do. You can take charge and you can prevent all the complications. Some of the common questions that I get from patients when they're first diagnosed with diabetes is, does this mean that I can't have any sugar? You can have everything, all food categories. It's the planning and the amount and the type of sugar that you eat that makes a difference. And we'll go over that in detail later. Do I have to exercise or join a gym? You don't have to spend money to be active. You can be active, you can walk, go out there, walk, and we'll talk about that more. Do I have to give myself shots every day? Not necessarily. As I said, if you still have enough insulin, we put you on pills to see if they work. But if you are far advanced in diabetes where your pancreas is not working anymore, then you need insulin, then you need shots. What if I feel overwhelmed? That's very common, and that's okay to feel overwhelmed because you are, given all this information when you're first diagnosed. Your emotional health is important. That's why we're here as a team. That's why you're here learning about it, listening to this lecture, because it gives you more information to be able to cope with that sensation of being overwhelmed. Diabetes is a team approach. So you have your primary care doctor, you can have your specialist, you can have the diabetes educator, you can have the registered dietitian, you can have a social worker, and of course also your pharmacist, who also plays a big role when they dispense their medication. So it's kind of a team approach. And then of course, I always tell patients, get your family involved. Family support, friend support is very important. So I'm going to cover a couple of sections. The first section is monitoring blood glucose. That's the first step you can take in managing your diabetes and getting things under control. I cannot overemphasize the importance of checking your blood sugars at home, because that's how you can tell whether your treatment plan is working or not. And then you can also manage your diabetes well, because then you know what to do if your glucose is too high or too low. So all of the diabetics out here, I hope you're using a blood glucose meter at home. Your doctor has outlined the target ranges, usually between 100 to 180. You check before a meal. Ideally, check 2 hours after a meal, and you check at bedtime. Before a meal, the American College of Endocrinology guidelines say before a meal, ideally you should be between 110 to 120. 2 hours after a meal, ideally below 160. You have to track your readings so that you can figure out, okay, what do these readings mean? Sometimes it's best to keep a blood glucose log. That way you can look at it. If you keep a food diary along with your blood glucose log, then you can go back and look and say, okay, this is what I ate, this is what my blood sugar was after I ate, say, item A or item B. So you can analyze for yourself. And that way you educate yourself. You take your blood glucose log and your food diary to the dietitian, to your physician, every time you have a visit, so your physician can look at it and say, okay, this is either working or it's not working, we need to change your plan. There are a couple of meters out there. When you go to the specialist, we can download it on the computer and analyze. So that's the basic thing about checking your blood sugars, is because you can analyze trends. Why? Because so you know what to do and your doctor knows what to do. We can make sure that your plan is working. You can also use those numbers to treat highs and lows. Sometimes when you're over 200, you will have symptoms. Sometimes you may not have symptoms. Some people have symptoms when their blood sugars are over 300. So you can't really rely on symptoms, because 200 is still high, or 220 or 240 is still high. You have to treat that. So if you don't check, you don't know. The symptoms of high blood sugars are usually excessive thirst, urination, feeling very sleepy, fatigued. So if you have any of those symptoms, that's when you should check your blood sugars to see if they're very high. What do? You drink water or other sugar-free liquids, but I always recommend water. That's the best way to hydrate when your sugar is high. If you're on insulin, you ask your doctor about extra dosage, especially if it's high in the 300 range. You check every 4 hours to make sure that your glucose is coming down. If your blood sugar hasn't come down within 12 hours, you should call your primary doctor or your specialist. The flip side is what to do if you're low. Most people can tell when they have low blood sugars because you get confused, you break out in sweat, you have a very fast pounding heartbeat, you start sweating. So those are all symptoms of low blood sugar. There are some people who've had diabetes for a long time who can't recognize low blood sugar till it's really low in the 40s. It's called hypoglycemia unawareness, and that you should talk to your doctor, because then the targets are a little different. Your goals are going to be a little different. We don't want you to be very tight, under very tight control. So what do you do if you have a low blood sugar? If it's less than, technically, if it's less than 70, that's what we call hypoglycemia. You eat or drink 15 grams of sugar. How do you know what's 15 grams? It's usually half a cup of juice, an 8-ounce can of regular soda, not diet soda. Or you should always keep glucose tablets at home. They're available at all pharmacies, Target, Walmart, wherever they have the glucose testing supplies, they have the glucose tablets. Read the label when you buy them. Most of them, 3 glucose tablets will give you 15 grams of glucose. You check your blood sugar every 15 minutes. If it's come up by 15 points every 15, it keeps coming up by 15 or 20 points every 15 minutes, it means that it's working, you're out, out of danger, out of the danger zone. Eat a small snack, a small healthy snack. And one other thing that you should always keep at home, especially people who are on insulin, is something called glucagon. It's a hormone that raises your blood sugar. And this is actually used by a family member or a friend. If the patient has really low blood sugar where you cannot eat or drink, you inject the glucagon. It comes in a kit. Keep it in the refrigerator. And a friend or family member should read the instructions ahead of time. It's very easy to use. And if the patient is not responsive or unable to drink or eat anything, you just give the shot anywhere you can. It's just put it in, press the needle, and it's done. Okay? Now you can monitor your blood sugars 4, 5, 6 times a day, so that's great. But sometimes we need other measurements to figure out whether your blood sugar is under control. So this is one of them, the A1C test. I'm sure a lot of you know about the A1C test. It gives us an idea about your average glucose over a 2 to 3 month period. It's a blood test, it's a measure in your blood test. As I said, it's an average over 3 months. It's reported as a percentage. We can also report it as estimated average glucose, or EAG, and I'll go over this chart with you. Basically, it measures how much glucose sticks to your red cell protein. Your red blood cells have a protein inside it called hemoglobin, and it has a very high affinity for glucose. So the higher the glucose in your bloodstream, the higher will be the amount of glucose sticking to the red cell protein. So that's what we measure. And because red cells have a lifespan of 120 days, which is 3 months, that's why we say that the A1C is a 3-month average, roughly. Okay? And our goal should be to try and keep the A1C below 7%, which roughly equates to 154 on your blood sugar meter. Okay? So here's a list of all the different hemoglobin A1Cs and what the corresponding glucose is. So if you went to your doctor this morning and your doctor said your A1C is 9, not good, because your average glucose is running 212. Okay? So you need to get it down to 154. Sometimes, based on the patient, how old they are, whether they have heart conditions, kidney disease, we set the goals differently. Sometimes 7 may be too low for them. I have a couple of 85, 90-year-old patients. You know, for them, 7.5 is fine. 7.5 to 8 is fine. You don't want them to be too low, because sometimes they're living alone. You don't want them to have a hypoglycemic attack and fall. Okay, so the A1C is kind of tailored to the individual, but for most patients, the target should be below 7, because that's where studies have shown that complications can set in if your A1C is above 7. Okay, the second part of this talk is all about food, creating a meal plan in diabetes. So that's very, very, very important. So there are a couple of challenges that we face in trying to design a meal plan. Is, you know, how do you plan? How do you create the plan? How do you put it into action? How do you stick to the plan that you've made? Because a lot of times, you know, it's hard. It doesn't mean that you have to stop eating all your favorite foods. You just have to learn how they affect your blood sugars and how to control the portion size so that it doesn't spike your blood sugars. So that's very important. That's where, you know, VITA comes in, that's where Sandy comes in. So all the registered dietitians and the diabetic nurse and educators will help you determine what foods are good for you and how they will affect your blood sugar. And you can help them by checking your blood sugars, keeping a food diary, and bringing it in at your dietitian visit so they can go over it and say, okay, this is what you ate, this is why your sugar went up to 300. They can help you design a meal plan. They can they can teach you how to learn about serving sizes, portion control, and your hand actually comes in very handy, no pun intended, okay? So you're supposed to have 4 carbs servings in a meal. A fist is about a cup. When you hold this, your hand this way, that's about half a cup. Your thumb is about a tablespoon. Just this part is about a teaspoon. So if you're confused, you can just use your hand to figure out, okay, this is the portion that I need to be on, and the dietitians can help you with it. You have to know how certain carbohydrates affect your blood glucose, okay? So there are different kinds of carbohydrates. Number one, starches. All the starchy carbohydrates are your grains, pasta, bread, fruits, veggies. Then you have the sugars, which are very simple carbohydrates. Those are the ones that you find in any processed food, anything refined, processed. Desserts, your fruit juices, your sodas, all of those are sugars. Those will cause real high spikes in your blood sugar. And the third kind of carbohydrates that you have are fiber. And that's actually good for you. They don't result in spikes because they're slowly broken down in your system. So you should balance out your meal with high fiber because they will prevent blood sugar spikes and they will keep your blood sugar level after a meal. To answer that question, does it mean that I have to give up my favorite foods? Not necessarily. You can eat from all food groups, okay? It's just you have to learn how to eat right. If you want to lose weight, then you do have to follow certain parameters. You have to cut all fat when you're cooking at home, trim everything, get all lean meat, low-fat dairy, low-fat cheese. Avoid packaged and processed food because that will cause weight gain. Reduce all your sugary foods such as sodas and desserts. And you have to lower the number of calories that you take in per day. I do have several younger patients who say, well, I exercise an hour every day at the gym and I'm not losing any weight. You can exercise till the cows come home, but if you don't cut down your calories, you're not going to lose weight. Okay, so it's a balance of the two. There's another important question. How often should I eat? So what you eat is as important as when you eat. Okay, it's not a good idea to skip a meal and then eat a big meal later. That will cause a spike in your blood sugars. You're ravishingly hungry. You end up eating more, and you gain weight. So the best thing to do is spread your meals out throughout the day. Small portions throughout the day. So breakfast, lunch, and dinner, smaller portions, healthy snacks in between. That's how you can keep your blood sugars level and you can actually lose weight too. Okay, so it's very important. Putting a meal plan into action. So when you're shopping out there at the grocery store, you have to read labels and a dietitian can help you with that. If you notice in the grocery store, if you go to the center of the grocery store, they have all the high carb, high fat, sugary snacks in there. So stay on the periphery because that's where you'll have all the better stuff, the veggies, the fruits, things like that. Okay, so choose veggies and lean meat. Choose whole grain products because as I said, whole grain has more fiber. So you don't get those blood sugar spikes. Low-fat dairy products will help you with weight loss because, as I said, in type 2, when you have insulin resistance, you should aim for weight loss because the more weight you put on, the more insulin resistant you become and the harder it becomes to control your diabetes. Here's an example of how to read a nutrition label. The first thing you have to notice is the serving size, 1 cup. Is that what you're intending to eat every time? Okay, then you go by these numbers here. But if you say, oh, it has only 17 grams of carbohydrate and only 100 calories, so okay, I can have 2 serving sizes. Well, that's not going to work. Okay, If you plan something, you have to stick to the plan and go by the label. Okay? The next thing you have to pay attention to is the fat. If you're trying to lose weight, try to keep it minimum. You have to avoid the saturated fat because that's bad for your heart. You have to pay attention to the carbohydrate amount, 17 grams, if you're trying to learn how to count carbohydrates. You can also pay attention to the dietary fiber. If it's less than 5, it really doesn't affect the total carbohydrates, but if it has high fiber, for example 10 grams, then you can deduct that from the total carbohydrates. Sometimes some people go on a higher protein diet, younger individuals with no kidney disease, they pay attention to the protein. So that's how you learn how to read labels, and so that you can incorporate that into your meal planning. So I thought this was interesting, the way our food industry has evolved. Look at what we had in 1970. That was the size of a bagel, and that was the size of a Coke. But in 2000, look at the size. And that's part of the problem. Okay, so we have an epidemic of diabetes because of weight gain, sedentary lifestyle, larger portion sizes, things like that. Okay, so when you plan a meal, this is what you should do. You should balance your plate. Okay, half of it you fill with non-starchy vegetables, salads, cauliflower, beans. The other half you split it in two. 1/4 you can fill it with your rice or your pasta or your bread, and the other 1/4 should be your lean meat or protein. So that's how you balance your plate when you eat. Eating away from home, that can be a challenge, right? So when you're at a restaurant, I just talked about portion sizes. So now restaurants now serve huge portions, right? But that doesn't mean that you have to finish all of it. A good thing to do would be to ask for a doggy bag right up front when they serve the meal. Set aside half of it. So then you can treat yourself the next day, right? You bring it home, treat yourself the next day. When you go to a buffet, again, remember that picture of the plate I showed you, okay? Don't load it up, okay? Split an entree or split a dessert with a friend or family member. That way you don't end up eating that much. Ask for sauces, mostly low fat. Ask sauces and dressings on the side so you can determine how much you want to put on your salad. And it's a good idea to skip the bread and the chips before the meal, okay? Because those are pure carbohydrates. How about alcohol? I get that question a lot. When you have diabetes, never drink alcohol on an empty stomach, okay? Because it lowers your ability to fight hypoglycemia, because it suppresses the liver. The liver plays a huge role when you have low blood sugar. The liver starts producing sugar, and alcohol suppresses that. Always moderation, okay? If it's Friday, Saturday night, you want to have 1 beer or a glass of wine, fine. But that doesn't mean a whole 6-pack or the whole bottle, right? Moderation. And remember, alcohol is calories and sugar. It does add up. So always remember that. Holidays and social situations. What do you do when it's hard to say no? You've gone to someone's house and your host wants you to eat everything. You can accept everything, but you can hold the plate with stuff on your plate and a drink in your hand. It doesn't mean that you have to eat and go back to the table and get some more, because that's going to really raise your blood sugars when you come home. Plan ahead. Sometimes it's a good idea to eat something before you go. That way you're not that hungry, and at your friends or whatever your host is serving, you don't have any control over that. But at least if you're full, you end up not eating as much. You can bring a dish that you think you can enjoy. It's low carb, not too much sugar. If you're throwing a party at home, prepare a couple of small dishes that you can have. Okay? So those are ways to handle holidays and social situations. So that was all about food. How about physical activity? As I said, when you have type 2 diabetes, even losing a little bit of weight goes a long way in your blood sugar control. You can just go out there, walk, that'll help. 30 minutes, 4 days a week, sometimes is enough. At least it's something. It's better than nothing. And then you can learn how to overcome barriers that are keeping you from going out there and exercising. As I said before, you don't have to spend money and join a gym. Walking, just walking helps. So which would you rather be? So how much activity do you need? You start off very slow, steady. First ask your doctor. If you have heart conditions, first take care of that. You can begin with 5 or 10 minutes, and then every 2 or 3 days or every week, you can work up to 30 minutes a day. 30 minutes a day, 4 times a week is all you need. If you want to lose weight, you have to work up to 60 minutes a day. And sometimes you have to combine what we call cardio and weights. And there are several things you can do. There's a diabetes exercise program that the hospital offers, and you can enroll and learn about what to do, what kind of exercises will help you. We still have that, right, Vida? Okay. Build up your strength. Some strengthening exercises you can add to your routine maybe 2 or 3 times a week. That builds up your muscles and strength and helps you and prevents falls, things like that. If you can't do any exercise, just walk. Use a pedometer, 10,000 steps a day will help, okay? Just hook a pedometer and see how much you walk during the day. Remember that every step you walk makes your insulin work better, whether it's your own insulin or whether the insulin that you're injecting. It's good to identify barriers because I sometimes get a lot of questions. I can't exercise because I don't want to walk in my neighborhood after dark. There's a solution for that. You can walk inside, you can dance to your favorite music, you can put in a workout video and exercise. There are several different videos that you can have at different levels, mild, moderate, and real aggressive. I'm too tired to be active after I get home from work. So you can take short walks during the day. You can walk at lunchtime. You can, instead of just sitting down on the couch and watching whatever's on TV, you can, again, put in a dance music and do a few steps. That'll burn a few calories, get your sugar down. It's too cold in winter. What do I do in winter? Find an indoor mall and walking up and down the stairs at home. That helps, right? So you have, it's best when you try to identify what the barriers are and how you can overcome them. When there's a will, there's a way, right? And the best thing to do is try to stick with it, and you can stick with it if you make it fun. Now, golfing may be fun for somebody, but for me, it's kind of a little boring. Okay. Keep it simple. Okay, your exercise routine can be very simple. You can do yard work, gardening. If you like to garden, that's great. Riding a bike to run errands, walking the dog, park far away from the store so you get that extra steps in. Take the stairs instead of the elevator. So these are simple things you can do. Fun things you can do is join a social group, bowl or golf with friends. Put on your favorite music and dance, find interesting places to walk, art museums and parks around the lake. Go to the park with your children or grandchildren. So that way you can make it fun and not feel like, oh, I'm stuck with this exercise routine. But always remember, when you have diabetes, especially if you're on insulin, it's very important to stay safe. I always encourage my patients to have an ID bracelet, a medic alert bracelet, especially if you're on insulin. If not, carry an ID card, and a cell phone. That ID card should have all your information, the fact that you're on insulin or what medications you're on, who your primary care doctor is. You can always set up a buddy system to go, walk with. That works. Medical alert bracelet we talked about. Use the right safety equipment. If you are biking, have the proper glasses, footwear, helmets. Stay hydrated. Doesn't hurt to carry water with you. Dress appropriately for the weather with proper shoes. You don't want to trip and fall. And always carry either glucose tablets or a candy bar with you, because if you get a low blood sugar, you have it right there with you. Skip your exercise routine if you're sick. Don't try to push it. And very important is when you first start your activity or exercise regimen, keep an eye on how it affects your blood sugars. For some people, exercise can drop their blood sugars. So then okay, before I go exercise, probably should eat a little snack. It's okay to do that. So this is still true. I thought I'd put in there, it's a little blurry, but this is before we had any insulin, any medications, any of your Actos, Januvia, Onglyza, whatever, right? Saying by Aristotle in 300 BC. We fall into ill health as a result of not caring to exercise. Okay, so much for exercising. Now, what about taking medications? That's important because those medications are keeping your blood sugars down. So you have to know how different medications work, where they work in your body, and how to develop a good medication routine. First of all, learning how medications work, there are about 4 organs that are involved in maintaining your blood sugars, and all the different medications that you have out there today target these 4 organs, either one or more. So the first one, the very important one, is pancreas. That secretes your insulin. And again, remember, insulin is the key. Some of the medications that you use, glyburide, glipizide, glimepiride, Prandin, Starlix, they work on the pancreas. They stimulate the pancreas to make more insulin. Okay? Your second most important organ is the liver, and that's where metformin works. The liver puts out sugar. A lot of the sugar that we eat actually is stored in the liver for times of need. That's how we were built to survive. So if we go for long periods of time without eating, there's a storage product called glycogen that breaks down into glucose, and that glucose comes out into your bloodstream and maintains your blood sugar level. Because remember, the brain still needs sugar to be functional. So that's how we survived long periods of starvation, is by the liver putting out blood sugar. Sometimes, well, not sometimes, all of the time in type 2 diabetics, the liver is a little overactive. Okay, it's because of insulin resistance. The liver puts out more sugar than it would in a non-diabetic individual. So that's where metformin comes in. It tells the liver not to make enough sugar. That's how it works to lower your blood sugars. Muscle and fat, that's where the sugar gets utilized. That's where the sugar is used up as fuel. Sometimes the sugar doesn't enter these cells. There's a blockage there, and that's where Actos comes into play. And the last one, the intestine, that's a recent finding in the last, I would say, 10 years. We found that there are intestinal hormones that also regulate your blood sugar. They come from the small intestine. And so now we've devised certain drugs called Byetta, Januvia, Victoza that mimic these intestinal hormones. Okay, so that's basically the 4 different organs. That's where your medications work. How do you manage your medications? First of all, it's important to be aware of all the drug interactions. Anytime you pick up a new medication from the pharmacist, always do a consultation. Always ask the pharmacist for drug interactions with your other medications. Stick to a daily routine. That's very important. If you stray from your routine, you tend to forget, and that will cause your blood sugars to go up later in the day. If you're on insulin, you have to learn how to do the injections the right way. If you are in any doubt, you can ask your provider, the medical assistant, the nurse, any number of times. Do not change or stop your medications without checking with your doctor. Sometimes you have all these newscasts about all the bad side effects of certain medication, and I do have a few patients who just stop it, and then they don't see me for 3 or 4 months, and their A1C is then 11. Okay, so it's not advisable to do that. You make an appointment with your doctor right away, express your concerns, and then the doctor will change your regimen to something that you're comfortable with. Refill your prescriptions before they run out. Don't let them run out, because even if you miss a few doses, your blood sugars can go up. And one thing to remember is that if your blood sugar goes to 250 or higher, sometimes it takes double the amount of medication, double the amount of insulin to bring it down. So don't get to that point. That point is called glucose toxicity. Okay? So it's important not to miss any doses. One good tip is to always prepare a small travel kit, because a lot of patients go away on the weekends. They have a lake home or some other place that you go to over the weekends. Always prepare a travel kit. Keep some extra vials of your medications, extra pills in that travel kit so you can grab it when you leave home or go on vacation. Get a pill organizer, because that helps you. Make it a part of your weekly routine. Sunday evening, you get your pill organizer in order, so you're set for the whole week, and it reduces any chances of error or skipping doses. And if you develop any side effects to any medications, you call your doctor right away. A quick note for family and friends, family members, for patients with diabetes is when you start somebody on a medication, or when you first give somebody the diagnosis of diabetes, as I said, it's very overwhelming. It's also very overwhelming when you start somebody on insulin, because now they have to do sometimes 2, sometimes 4 shots a day. So it's very important to be supportive. You have to learn to recognize signs and symptoms of low blood sugar or even high blood sugar. You have to be prepared to give glucose tablets, juice, or as I said, glucagon. If the hypoglycemic reaction is really severe and your family member can't really drink anything or chew on the glucose tablets, just take out the glucagon and give the glucagon. You can't go wrong. It's a kit, it's self-explanatory, and it's very easy to do. And also be supportive of meal planning. Okay, that's important too, not just medication. Adjusting to any medications, you have to prepare yourself for a slow, steady progress. Nothing happens overnight. You have to give it a little bit more time, especially if you came into the doctor with very high blood sugar. And the small changes that you make always add up, and then you're going to see the effects later on. Always establish a daily routine of taking your pills or doing your injections. Timing and routine is very, very important. You have to plan ahead. Anytime you disrupt the routine and you start doing something else, you forget, right? And then if you were supposed to take a shot at 8 in the morning and you started doing something else, it's noon and you realize, oh, I didn't take my medication or I didn't take my insulin. And then by 4 o'clock that afternoon, your blood sugar is 300. So always stick to a routine. Ask for support. As I said, your support system is a big team. You have your family members, your friends, your primary doctor, your endocrinologist, the dietitian, the educator. Everybody's there to support you with questions or concerns. And the other thing is when you start with diabetic medications or insulin, it's okay to go through mood swings and anger, frustration. So acknowledge those new emotions. It's okay. Eventually you'll get the hang of it. You'll get adjusted to the routine. Just stick with it. Maintaining overall health, emotional health is very important, as I said. In terms of overall health, when you keep your blood sugars down, as I said, you prevent the damages to all the organs that I talked about earlier. And there are a couple of things you need to be aware of in terms of what to do, how to change your routine under certain special circumstances. For example, if you're very sick, you're throwing up or diarrhea, or you're traveling, and I'm going to go over that. First of all, let's talk about emotional health. Diabetes is a chronic condition, so it can be challenging, it can be overwhelming. It's okay to acknowledge that. You have to come up with ways to deal with stress, and that's where your physician can refer you to a clinical psychologist. You can meet with family members. You can join a support group. You can come to sessions like this where you learn more, and knowledge is kind of powerful. It helps you cope with your emotions also. Okay, you met so many other people today with diabetes. It's not that bad. Okay, everybody's managing. Avoid burnout. Don't try to push yourself too much. Take time to relax, set your priorities, and recognize depression. And if you need help with depression, it's okay for 3 or 6 months to get that help till you learn how to cope with your diabetes better. You have to make sure that you are aware of all the risk factors that damage your organs. Blood glucose is one of them. So A1C should be below 7. Blood pressure plays a very important role, especially for patients who have heart disease or have had strokes. You have to target your blood pressure, keep it below 130/80. Cholesterol is the third thing that's very important in all diabetic individuals to prevent damage to your heart, kidneys, nerves. Your LDL, which is your bad cholesterol, should be below 100. HDL, your good cholesterol, should be greater than 40 in men, 50 in women. And your triglycerides should be greater than 150. There's one other thing that should be checked at least once a year, preferably twice a year, and that's measured in your urine. It's called microalbumin. It's a test of kidney function to tell us whether you're spilling any protein with your urine, and the amount should be less than 30 milligrams. If it's more than 30 milligrams, that means that your kidneys are damaged, and so you need to take better care of yourself. Eye exam once a year, every year, is very important because your eye doctor keeps up with your eye health, looks at the back of your retina to see if you have any diabetic damage. If you have been out of control for a long time and now you're seeing a specialist and the specialist is bringing your blood sugars down, it's very important to go to the eye doctor right away, because sometimes if you already have eye damage, it can get worse before it gets better. So it's important to remember that. And it's easy because they do laser to take care of it. Reducing your risk of complications, proper foot care is important. Never walk barefoot anywhere, even at home, especially if you have been told that you have neuropathy. Eye care we just talked about. Diabetics do tend to have a lot of periodontal disease, so keeping up with your dentist is very important. And for younger people, type 1s mainly, and I'm also seeing a lot of younger people with type 2s nowadays, you have to get pre-pregnancy counseling from the diabetic educator before you get pregnant, and learn about how pregnancy can affect your blood sugars. What do you do when you're out on the road, either driving or flying somewhere? Driving, always check your blood sugar before you get behind the wheel. It's very important, because if you have a hypoglycemic episode and you have a motor vehicle accident, the cops can take away your license, and then you have to go through a lot of paperwork, and then you have to go to your doctor, sometimes a specialist, to get clearance before they will give you the license back. Always have glucose tablets with you, either glucose tablet, snack, juice, keep it in the glove compartment. If you don't feel right while driving, pull over right away. Don't take any chances. Your diabetic supply should be right next to you, okay? In the side compartment next to you, in the seat next to you, not in the back seat or in the trunk of the car. That's important. Uh, if you're carrying insulin with you, store it at right temperatures. If you keep it in your purse or a little kit that you take with you and take it with you, if you're running errands, that's okay. But don't leave it in the car, because the heat inside the car, the temperature inside the car can go up to 110, 120, especially in summer. And that will spoil the insulin. Remember, insulin is a protein. Just like milk spoils if you leave it in the car, your insulin will spoil too. But you can keep it in your purse or your little travel kit and take it with you. Always make up a toolkit with medications, testing supplies ahead of time if you're driving long distances. Okay? Traveling and flying. You have to be prepared to check your blood sugars everywhere you go. If you don't take your testing supplies, and if you have a low sugar or very high sugar, you won't know how low you dropped and how to treat it. If you're traveling, check with your airline about guidelines. Most airlines now require that you carry the medication with the original pharmacy labeling on your medication. Sometimes it's not enough to just take a note from the doctor. You have to have the original pharmacy label. Carry the travel kit with you. Make up a travel kit, carry that with you at all times. Make sure you have proper identification of all your medications, your physicians. Stay hydrated. They don't let you take liquids, but get a bottle of water once you're past security. Keep it with you. And if you're traveling across time zones, check with your doctor about what to do with your medication. How about sick days? If you're sick, what do you do with your medications? What do you do with your insulin? The main thing about sick days is your blood sugar can be really erratic when you're sick. It's mostly high, not really low, because illness is kind of a stress response. So any stress response will release your stress hormones from your body, and that will tend to raise your blood sugars. If you can't drink liquids, but make sure this time you drink liquids with sugar in them, because your body still needs that fuel. Otherwise, you can go into something called ketosis, because it tries to burn fat and protein, and the byproducts of that are ketones. And when that ketones build up in your body, you feel even sicker, and you can actually end up in the ER. Drink plenty of water, stay hydrated, and you have to talk to your doctor about adjusting your medications. The key is to check your blood sugars often. If you're on insulin, if you already have guidelines from the doctor about what to do, which you should, then you can give yourself the insulin every time you check. You check every 4 hours based on your guidelines given by your doctor. If you're really high, you can take that extra small dose of insulin to bring it down. It's important to know when to call the doctor when you're sick. If you can't keep liquids down for more than 4 hours, if you have vomiting and diarrhea for more than 6 hours, if your blood sugar stays above 300 or under 70 for over 12 hours, if you have not been able to eat or drink normally for 24 hours, if you have a fever over 101 degrees, of course, if you have trouble breathing, and if you can't stay awake or think clearly, have confusion. It's important also to plan for any kind of emergency or disaster planning. It should have a diabetes toolkit. It's usually an insulated, waterproof kit, a little bag containing all these items: an ID card, small samples of all your medications, syringes, your glucose meter, testing supplies, glucose tablets, copies of your prescription numbers, your physician information, pharmacy information, a complete list of your medications, and photocopies, if possible, photocopies of your latest lab reports. Okay? And you have to update this kit at least twice a year. So with that, that's all I have. There are resources that you can access: the American Diabetes Association, American Association of Clinical Endocrinology, the NIH, and the Diabetes Educator Association. So I'm open for questions. Thank you for your attention.
What happens when you feel dizzy?
Usually dizziness can be due to several other medical conditions also. It can be low blood pressure, low blood sugar, if your heart rate is dropping. So dizziness has to be evaluated by your primary care doctor. You can't just assume that dizziness is due to sugar. But if you are diabetic and you're checking your blood sugar and your blood sugar is 60, then that's probably the reason for your dizziness. So eat something.
What is pre-diabetes condition?
Okay, the question is, what is pre-diabetes condition? I didn't go over all the details about diabetes because we did that session not too long ago and it's still playing on channel 78. But diabetes is a process that develops long before you're actually diagnosed with high sugars. Okay? There is a period of sometimes 10 to 15 years before you're diagnosed where you have insulin resistance and your blood sugars are slightly high but not high enough to call it diabetes. Okay? That's what pre-diabetes is all about. And you can take care of pre-diabetes by exercising, losing weight, eating healthy so your blood sugar doesn't go higher and push you over to diabetes. As long as you are monitored and your blood sugar doesn't go into the diabetes range, it's still okay because you are taking care of it. You're exercising, you're eating right, and your blood sugars are not going any higher. So diabetes is actually, there are two ways to get diabetes. One is your genetic predisposition, you're born with it, there's nothing you can do. And the second way is the environment. You know, your sedentary lifestyle, poor eating habits, things like that. So at least if you take care of that one arm, there's nothing you can do about genetics, it's still going to be there, but at least your blood sugars don't go higher. Yes?
You mentioned different medications. How would I know what medication do I need to take?
Your physician will determine based on your blood test results, on how high your blood sugars are, whether you are under control or not. Your physician determines what medications to start you on.
What exercise you suggest for those who cannot walk due to knee pain?
You can do a stationary bike, okay, and that, you know, it doesn't hurt your knees. Get a stationary bike. You can do some core strengthening exercises, and you can enroll in the diabetes program and they can show you some of those exercises.
And would a damaged pituitary gland affect you into developing diabetes?
Would a damaged pituitary gland affect diabetes?
Develop it. Will it make you develop diabetes?
Would it make it develop diabetes? No. No.
If your bad cholesterol, the LDL, were in the range of, let's say, 105 to 110, would you suggest that your patient take a cholesterol medicine?
It's a very individual approach. We have to take into account the risk factors for that patient. Okay? If it's a young individual who I know has no problems with blood pressure, exercises regularly, blood sugars are great, sometimes I'll watch it. On the other hand, if it's somebody who has a significant history of heart disease in the family but is doing everything right, okay, I will put that person on medication. And of course, if it's an older individual who has documented heart disease, yes, we try to keep the LDL cholesterol, get it down to about 70. That's the current guideline. If you already have heart disease, LDL should be as close to 70 as possible.
I am a diabetic for the last 25 years. I am on insulin now, taking 30 units in the morning, 30 units in the evening. Now I want to ask you, taking this injection is very painful. Is there any medicine available or any injection available? Take only once for at least for 3-4 months. Like that, any medicines are available? And second thing is, this injection is to the inner thigh and around the navel. These are the portions I am taking. So that areas are all bulging like anything because medicine going inside. So is there any alternative for that?
I can talk generally about it. I cannot really, in this setting, I cannot give any personalized recommendations. Okay? But insulin, there are different kinds of insulin. Depending on the stage of your diabetes, the insulin dosing may be different. Okay? If you are far advanced in your diabetes, as you said, 25 years, one kind of insulin is not going to work. That's the simplest answer I can give you. Okay? You'll need a short-acting and a long-acting and more than one shot. Okay? Because remember we talked about the pancreas, and the pancreas, when it's burnt out after 20 years, you need both kinds of insulin and you need more than one shot. Okay? That's how the body works. As far as injection site, most of the insulins have to be done in the stomach area. You can spread it out. You don't use the same spot over and over again. That way it doesn't bulge out, as you put it. And that's where the diabetic educators come in helpful, because if you are in doubt, you can ask your physician to send you to the diabetes program, and they can go over the proper injection technique with you.
By taking these injections every day, is there any harm will take place to the body?
No. Is there any harm in taking injections? As long as you're doing the injections the right way and you're under the care of your physician, there shouldn't be any harm.
I have a question. What causes, if you go to bed with a level of glucose and you get up in the morning and it's much higher than when you went to bed, what causes it to elevate during the night?
I get that question a lot. Okay. Remember we talked about the liver, how it plays a big role in maintaining your blood sugar, especially if you're low. That's what happens during the night. Anytime we go for more than 5 or 6 hours without eating anything, the liver starts producing blood sugar. That's what happens from starting 2 or 3 in the morning. We have a bunch of other hormones that come into play around 3 or 4 in the morning, and that's your body's natural steroid called cortisol, growth hormone, a couple of other hormones that tend to raise your blood sugars. Okay? That's why even though you went to bed with a 124 and you didn't eat anything, you wake up and it's 156. One other thing to remember when you wake up with high sugars is to make sure that you're getting enough sleep. Okay? And there's a lot of recent literature on sleep deprivation and how it affects your blood sugars and your blood pressure. You have to get at least 6 to 8 hours of sleep minimum, and the deep sleep, to keep everything under control. If you're sleep deprived, if you have sleep apnea or you keep waking up, that can actually raise your blood sugars because it's kind of a stress response. Okay? So if that's happening, you need to talk to the doctor. And it's not okay to just sleep 3 or 4 hours and then take naps during the day. Studies have shown that it's not beneficial. Any other questions? Well, thank you very much. Have a wonderful evening.